Hello people. In this video, let us look at slow virus diseases. Basically, there are some virus which cause the disease very slowly. That's all. Slow virus diseases. Okay. There are some complicated names here. You need to know them. Basically, slow virus diseases, why they are called slow? Look at that. There is a long incubation period. There is a predilection for the central nervous system it will affect. Strong genetic predisposition can be there. These are not very antigenic. They don't cause an immune reaction. There is a lack of an immune reaction. There is lack of associated inflammation. And even when you check the cytopathic effects, there are no cytopathic effects in vitro. That means in the lab. But in vivo, there will be cytopathic effects, I'm guessing. Okay. So basically, these are slow viral diseases. Why they are called slow, you understood? Now, let us look at these disease names. Okay. Because of virus. Proper virus, if it is because of, then we are looking at that in this video. Prions, if you are looking for prions, then come to the next video. Prions itself will take up in separate one. Okay. So these are slow virus exactly because of virus, then we have put it here. So basically because of conventional virus, if it is, then here, okay. So basically here you should know this one, subacute sclerosis panencephalitis. So means something to do with the brain, right? So subacute sclerosis panencephalitis. Subacute means sometime later, let's say, sclerosing panencephalitis. So basically this is caused by a defective measles virus, okay. Some years after a person gets measles, some years later after latency, he might get this subacute sclerosing panencephalitis. Pan means all over, right? Like everything is affected kind of a thing. Panencephalitis. So usually this is seen in humans. Here again some sclerosing panencephalitis itself is written here. Then you have progressive multifocal leukoencephalopathy. This is caused by JC virus. What do you mean by JC virus? This is a member of polyoma virus, polyoma viridae. As per Google, this stands for John Cunningham virus. Okay. Again, it affects the human brain CNS demyelination. Okay. Textbook says it affects the oligodendrocytes are affected. Okay, it causes CNS demyelination. So can you remember this? PMLE, is it? Progressive multifocal leukoencephalopathy. PMLE, is it? PML they are saying. We will put an E. Textbook says PML actually. Okay. They are saying it occurs in about 5% of patients with AIDS, this one. Okay. In immunosuppressed conditions, this can occur. That's in 5% of patients with AIDS, they are saying. Then you have the Visna virus and the Maedi virus. These are affecting the sheep. Pay attention here. These are affecting the sheep, not the humans. Now let us see what happened to the sheep. According to the internet, this is what it says. Limb paralysis due to infection with Maedi Visna virus. Okay, this is affecting the sheep. So this is a slow viral disease. Visna virus, Maedi virus. They are retroviruses, they affect the sheep, they cause again CNS demyelination is written here. And for this Maedi virus, M-A-E-D-I, Maedi virus, it is progressive pneumonia, okay. So have you understood slow viruses, what happens? Okay. Just look at the little more information on SSPE, that is subacute sclerosing panencephalitis. Basically, these people will have a history of measles infection at an early age, usually younger than 2 years, and then because after a latent period of 6 to 8 years, the neurological symptoms can begin. Mild mental deterioration, changes in the behavior of the person, all these are neurological, right? Disturbances in the motor function, seizures can be there. And these people die within 1 to 3 years of diagnosis is written here. For updated information, please check your textbook, okay? So we are done with the slow viral diseases, that is because of the conventional viruses. Now let us look at the prions, right? Prions and what prions are and what diseases they cause. So let's look at that in the next video. What say? Okay.